Well, on to something that's affecting millions of Americans, healthcare disparity. Joining us now with an exclusive look into the new documentary, The Color of Care, are Oscar and Emmy-nominated filmmaker Yancey Ford and Dr. Hetty Cunningham. Now, the series is executive produced by Oprah Winfrey, and it traces the origins of racial health disparities and how they continue today. Both of you, welcome to the show.
Good morning, Jason.
Good morning.
Yancey, let's begin with you. What are some examples of racial health disparities?
Well, some examples of racial health disparities are the fact that Black patients don't get treated for pain in equal, statistically in equal manner that white patients do. There is a test for kidney function that has a built-in part of the formula that shows kidney function as not accurate for what it actually is for Black patients. Black maternal health care. Black mothers and Black children are more likely now to die during childbirth than they were during slavery. And that number alone should stop people in their tracks. And I could go on, Dr. Cunningham could go on about the way in which health disparities that break down along racial lines make themselves evident in healthcare. But the fact of the matter is that these disparities go back to slavery, and there is evidence and there are studies to back this assertion up. And we hope that The Color of Care is the beginning of a conversation about how we can do away with these disparities.
Dr. Cunningham, how did we see these disparities manifest during COVID?
Black and brown people during COVID had so many ways that disparities manifested. They had to go to work every day. They were frontline workers, and they died in hugely increased numbers compared to white people in this country. So, as the film shows so elegantly, families went to care. They went to one hospital, two hospitals, three hospitals. They were turned away. Oftentimes because the hospitals did not have the resources to care for them, which is something that we find in Black communities, that the number of hospitals, the number of resources are dramatically less. And that's one of the biggest healthcare disparities. And then in addition, even when they were at the hospital, they were not believed. They were not, their words were not trusted. So these are some of the ways that these health disparities manifest. And the film makes it very clear.
100%, doctor. And we see many people, especially celebrities and people who have massive platforms, also speaking out about the disparities of people of color when it comes to receiving proper and basically good health care here in our country. Yancey, what are you looking for people to learn or change after watching the documentary?
That both for executive producer Oprah Winfrey and myself, we are looking for people to reconsider how they approach patients when they are in a care environment, to recalibrate the relationship between patient and doctor, to start with the basic assumption that the person that you are treating is as equally human as you are.